Okay, Professor Smallhorn and I are going to make a very quick video to overview and review some of the material that we were not able to cover last class. It's important for you to know we did cover chapter 32, and that dealt with antibiotics and anti-infectives. And there was some general health teaching and information and nursing process there. So if you did not attend the class after the test, it's your job to connect with the student and get caught up with that information.
Correct.
Moving forward, chapter 34 and the remaining chapters from that week will be presented in this video. So please review this video, and if you have questions, post them on our discussion board. Chapter 34 is a rather overwhelming chapter. If you do read it, it's rather extensive, and we've reviewed it on a number of occasions. And what we ask is that we want you to hone in on the herpes simplex virus. There is a lot of information in this chapter on multiple viruses, but the medication we want you to learn about is acyclovir or Zovirax. So we're going to tell you to turn straight to 471. And do we want to tell them why we're doing this?
Because they're going to learn more about the other viruses next year at this time.
Right. So you will get this information. It's just perhaps not the most ideal timing of the course to give it to you now. So in any case, antiretroviral medications, whether we're talking about influenza, herpes simplex 1 or 2, or HIV, very important that if you are going to put a client on an antiviral medication, that their body is physically able to handle that medication. And so clients need to have a good relationship with their doctors. They need to assess their liver and renal function. Our goal with any antiretroviral medication is to decrease symptoms and increase optimal health. And so really what we're saying is we want to decrease the viral load in the body and increase the body's ability to fight the infection. But it's a little bit too deep for this level.
Yeah.
So we're going to point you to our client education over here, and you can read these one by one. And if you have any questions, we want you to bring them to class or post them on the discussion board. But right now you see here, monitor HIV RNA assay, CD4 count, liver function. At this point, because we're not going to be talking about this, we don't want you to focus in deep on this material. Really, we want you to know the herpes simplex virus. So we'll drop a little thing right here. We really want you to understand herpes and acyclovir. So know this. All right, and I can hit close. Any general information we should tell them about viruses?
Just remember that viruses live in the body even though you may not be symptomatic. So for instance, we used to see this a lot in when I worked OB. So a woman would come in labor, and viruses tend to be triggered when your immune system is low or battling something else. So when a woman comes in labor, her body is extremely tired and very busy trying to make sure that the baby is delivered in a healthy state. So what happens is they'll come in, they have a history of genital herpes, but they don't have any sores present. Then as soon as they go into labor, they'd end up with sores erupting because their body's in sort of, I guess, a weakened
physiological
state.
Stress.
Physiological stress, exactly. So most women, if they do have a history of genital herpes, they will be given the option to deliver via C-section, because if the baby's introduced to the herpes virus as it passes through the vaginal canal, it can cause all sorts of problems, even death.
Right.
So.
Yeah. And I think the other important, if I haven't already said it, and I may have, is it's very important for you to understand that clients can be asymptomatic, and that's why routine precautions are extremely important for us as nurses to help prevent the spread of any infections. It's also important to teach families and significant others at home that just because there's not a symptom present, that the transmission is sometimes misunderstood or thought that it can't occur if there's no outbreak or no sore. Truthfully, it's very important to teach clients to wear barrier protection, regardless of whether there is an outbreak. And if there is an outbreak, obviously you want to abstain and take the medication as prescribed, etc. It doesn't cure the virus. There's a lot of misunderstanding out there that if they take their medication, they can't transmit it to someone else. Whether it's a cold sore or whether it's any type. So herpes simplex 2, herpes simplex 1. Very important to read these. Chickenpox, varicella virus, Epstein-Barr. We'd like you to read these. These we think are important, common, and expected to know. But we'll turn straight to Zovirax or acyclovir. Notice how the medication ends with vir. That might be a good indication that the medication is for virus. Again, so if you're looking to make a connection, the last ending of the word ends with vir. Many antiviral medications may have that similarity. Over here, you can read these on your own. We won't be asking you to give, or won't be expecting you to know the IV route of this medication, etc. But very important, administer it with food, hard on the GI system. Acyclovir is 75% absorbed for oral administration. Distribution is wide. It crosses the placenta and enters the breast milk. It enters the CNS, etc. So if you have any questions, please post them on our discussion board. Please email us or bring them to class. And if you do email us, we'll usually post a response on the discussion board. Here's some general information to include regarding antiretroviral medications. So important, even though they may not be symptomatic, to keep all follow-up care so they can monitor their liver and their kidneys. Take necessary precautions. Some medications may cause dizziness. Don't drive until you've established whether or not this does cause dizziness in your body. And prior to taking any over-the-counter medications, double check these with your doctor. And usually if they're on an antiretroviral, they're on it for life.
Yeah.
Yeah. So they have the virus in their body, and with the exception of influenza.
Yes.
And it for life. So it can be managed with diet, nutrition, stress reduction, but ultimately you may have to resort to medications. And I think that's all I really want to say about this.
I think so. Yeah.
Okay. All right.
So we're going to move on.
We are going to pause this and we'll move on.